Hello, welcome, and happy Friday. My name is Miss Fenton, and I teach at Stevenson High School in Lincolnshire, Illinois. And together with another instructor, Dr. Swope, we're going to be bringing you daily AP Psychology review sessions every day, every weekday until May 1st. Each session will be about 25 to 45 minutes. So just a quick reminder for those of you tuning in for the first time. In case you didn't know, this year's AP Psychology exam will be 45 minutes, online, free response, and it can be taken from home. Additional details about this year's FRQ setup are going to be announced on April 3rd, and Dr. Swope and I will be sure to keep you updated. One more time, there are 9 units in the AP Psychology curriculum, but this year's exam only will cover the first 7. So units 8 and 9 will not be on the exam this year. And it's wonderful because colleges and universities are supporting AP students and the unique situation that we're all in this year by offering a more flexible approach to the exam that covers less content. Today, for the third day, we're going to focus on Unit 8, but to make this session relevant to your reviewing, I'm also going to add in a bunch of exam prep and review material. Starting this Monday, we are going to start with Unit 1, which is history, approaches, careers, and of course, research methods and statistics. And then we are going to go between then and May 1st through Units 1 through 7, potentially touching base on Unit 9 towards the end. We will be posting a full calendar shortly so you can plan out your review sessions. Okay, today we're going to start with our regular warm-up, the review of yesterday's practice FRQ. We're also going to talk about the nervous system. We're going to introduce the final couple categories of mental illnesses, talk about treatment, and end with some more AP practice. So this was the practice question that I gave you yesterday. It was a little bit longer, and it's a modified version of a previous AP exam. So hopefully you had time to answer each of the questions and you remember to use SODAS. So with SODAS, we ask that you put a little bit of space between each concept. O, answer in order. D, give a brief definition. And although definitions alone do not score, you see that right there on the prompt, they are extremely helpful. And finally, apply to the situation. So explain for part A how this will help Danny succeed and how in part B it might hinder him. Finally, you want to double check for synonyms and make sure that you're not just repeating the term in your application or definition. So first up, we have GABA. And you should probably, the most thing you should remember about GABA is it's the major inhibitory neurotransmitter, and it's related to anxiety regulation, right? So low levels of GABA would prevent individuals from monitoring their anxiety or arousal level. So for the application, you want this to help Danny. So he can do well on the test because his levels of GABA prevent the excessive spread of excitation within his nervous system. And that reduces his anxiety. If you reference whether it's a quiz or a test, it's as long as you're talking about Danny and the situation with his performance on this assessment in his geography class, all of those would be fine. Okay, the next term was something we talked about yesterday. It's a behavioral therapy method, systematic desensitization. And this is one of those terms that I wanted to put in here because I mentioned before that while some definitions are pretty straightforward, you know, the hippocampus is a limbic system structure responsible for encoding new memory. Others are more complex. So this one has almost like 3 parts, right? So you have to teach relaxation methods, develop a hierarchy, and then help the individual work step by step through that hierarchy. With an application, you want Danny to do well on his test because he's using this method, right? He created the hierarchy related to the steps of his fear of presenting, and he learned some relaxation methods, and he's been practicing step by step working towards that final goal of presenting or participating in the oral quiz. Now with part B, remember this time you had to have it hinder Danny's success. And for this one, they gave you the sympathetic nervous system. So the sympathetic nervous system is part of the autonomic nervous system, and it's your fight or flight response. It prepares the body for emergencies. And I want you to note with the sympathetic nervous system, basically everything is elevated physiologically except anything related to digestion, like salivation. So in this case, it's going to include all of these pieces, right? So you want something physiological in your definition and application because this is a nervous system. So here's a couple of examples that would score. Danny does poorly on the geography test because the fight or flight aspect of his nervous system prevented him from focusing. Or potentially you want to mention just general physiological arousal or increased heart rate caused by a sympathetic nervous system hurt his performance. Now I want to show you a couple things that might not score. So first of all, if it's your application, it has to be a negative impact for Danny. And you have to be specific. It would be best if you use a specific physiological change, like an increase in heart rate or increase in blood pressure. If you just wrote Danny did poorly because he was stressed, that doesn't clearly bring up that physiological piece. It's not really referencing the nervous system, and that would not score alone. Also, if you just simply said that basically his sympathetic nervous system made him nervous, that's a synonym problem that we talked about with the SODAS. So you're just basically replacing nervous system with nervous. And it's really easy to do that, especially if you're writing for time, you're under pressure. So that's why SODAS is really helpful. When you complete your FRQ, go back and take a look at each of your examples and double check that you might not need to throw in a little synonym there. So if you just added after because he was nervous and it made his heart race, then you'd all of a sudden be okay. So, okay, just a quick, since we're talking about the sympathetic nervous system, I thought I would throw up a diagram of the broader nervous system. So you have a central nervous system, which is the brain and the nerves of the spinal cord. And certainly you could have a bunch of little boxes underneath brain. We could divide that up into hindbrain, midbrain, forebrain. But the peripheral nervous system, all the nerves that extend from the spinal cord, would have two main parts, the somatic and the autonomic. And with somatic, these are your motor nerves that are carrying messages from the brain and spinal cord to the skin, muscles, and joints. And then you have sensory nerves that are going the other direction, carrying messages from the body to the spinal cord and brain. Then on the other side here, you have the autonomic nervous system, which is something that sends signals between the central nervous system and the glands and internal organs of the body. So this has two components, sympathetic, which we just talked about, which is your fight or flight response, and the opposite, parasympathetic, which is rest and digest. So in this one, rest and digest, any functions related to digestion, like again, salivation or digestion functions would be elevated, but the heart rate would also be lower. The constriction of the pupils would occur. And this is also relates to systematic desensitization. Because if you remember, Joseph Wolpe said that you can't be simultaneously in fight or flight and rest and digest. So the whole process of systematic desensitization is about replacing that stress response with a relaxation response. I just put in a little slide here that's just completely blank if you want to practice later, test yourself on the nervous system's organization. And one more time with SODAS, no intros and conclusions, and space, order, define, apply, and synonyms. At the end of today, I'm going to give you another FRQ. It's going to be even a little bit more challenging, so we're going to keep building as we go along. We work closer to the exam. Okay, what we're going to cover today, the final two main categories of mental illnesses from the DSM-5. We're going to take a look at perspectives and treatment, and special attention to the biological perspective. Okay, some study at home tips. Yesterday, I mentioned the APA dictionary online. If you need to look something up, go beyond your book. Today, I also added a link to 3D Interactive Brain. So this is put out by brainfacts.org, and it's a three-dimensional brain. And when you click on, say, the cerebellum, you can look at it from different angles, and it'll give you a really great summary of the functions and locations of all of the parts of the brain. Okay, as promised, our last two categories. And these two categories are actually really listed early in the DSM because these are typically diagnosed early. So this category includes disorders that are diagnosed early in childhood, and they involve problems generally related to cognition. You have intellectual disability, which is difficulties in cognitive processing, reasoning, learning, problem solving, and adaptive functioning. It's typically represented by an IQ that is two standard deviations below the mean or below 70, but it's important to note that this cannot be diagnosed by IQ score alone. Autism spectrum disorder are varying degrees in communication, social interaction. These individuals might have difficult with language, social development, cognitive development, unresponsiveness, or potentially rigid and repetitive behaviors. Now, if you take a look at autism spectrum, this is an aspect that's new to the DSM-5. They're taking a dimensional approach. So they're saying that clinicians found that individuals with autism vary widely in their levels of severity. So we're looking at it in terms of a spectrum. Also on the spectrum is schizophrenic spectrum disorders. So these are categorized by significant disturbances, often in, if you're talking about schizophrenia, this would be the more severe diagnosis of the two. Significant disturbances in cognition, that might be delusions, emotion, perceptions like hallucinations, behavior, movement, or speech that dramatically impair functioning. Schizotypal personality disorder are individuals who are emotionally and socially detached. They often have very unusual beliefs and behaviors. It's similar to schizophrenia, but much, much less severe. And it is unique because it is listed as kind of an aspect of the schizophrenic spectrum disorders, but it is also listed in the personality disorders section as well. Okay, schizophrenia. Schizophrenia symptoms are kind of divided into two broad categories: positive symptoms and negative symptoms. So positive symptoms are things that are added, they're in addition to normal behavior. And this is kind of what is happening. Negative symptoms are the absence. And this is very similar to that positive and negative reinforcement you see in the learning chapter. So positive is not happy, it is addition, right? So it's the presence of something that wouldn't normally be there. And kind of the hallmark, most commonly reported or discussed symptoms, I should say, of schizophrenia that are positive are hallucinations, which are false sensory experiences. And the most common type of hallucination is auditory, which would be hearing voices. Delusions are a little bit different. Those are false beliefs. These could be delusions of persecution, this false belief that they're being plotted against. Individuals who experience delusions of persecution are often very hypervigilant and agitated. They could also have delusions of control, false beliefs that their thoughts or behaviors are being kind of manipulated by an outside force. On the negative side, these are the absence, right? So this could be flattened emotions, lack of kind of ups and downs in positive and negative mood, social withdrawal, like lack of speech, withdrawal from social situations. Schizophrenia is really researched, and it is primarily a brain disease. So when we're looking at describing or explaining disorders from the 7 perspectives, with this one, you're really looking at the biological perspective. There is definitely a genetic vulnerability to this condition, and that data is based on twin studies and family studies. So for example, with monozygotic twins, if one twin develops schizophrenia, there's a 50% chance that the other identical twin will develop the condition as well. If you have dizygotic twins, which are genetically 50% the same, which are basically siblings, there's about a 7 to 12% chance that the second twin would also develop schizophrenia. If an individual has one parent with schizophrenia, the risk is 13%, but both parents, it jumps to 40 or 50. So there is a genetic piece to this. Now, the neurochemical factors, there's a couple of different, 2 main neurotransmitters that are investigated with regards to schizophrenia. And the first one's the dopamine hypothesis. And this is a theory that schizophrenia is caused by excessive amounts of dopamine. Therefore, the medications, antipsychotic medications, typically are designed to block dopamine transmission, which makes them antagonist drugs. There's also a glutamate hypothesis, which is kind of a newer research is indicating that potentially glutamates, the underactivity of glutamate, which is the major excitatory neurotransmitter, and it's actually a far more prevalent neurotransmitter in the nervous system, is probably better at explaining the full range of symptoms. And of course, as we mentioned yesterday, there's this idea of a diathesis stress model, where you have a predisposition that is either genetic or environmental, and then a stressor. And that seems to really be related to onset and severity levels. Okay, looking at kind of differences in the brains that can be observed with people with schizophrenia, and kind of the most commonly reported or studied one is this idea of enlarged ventricles. So if you look at the brain on the left, the schizophrenia brain, those ventricles, those spaces, those interconnected spaces or cavities in the brain that are filled with cerebral spinal fluid are much larger in the schizophrenic brain. And enlarged ventricles mean that brain tissue or amounts are reduced. And longitudinal studies do indicate potentially progressively more loss over time. And more loss is definitely associated with an increase in kind of negative outcomes. So you might see an example like this, demonstrating the difference in terms of the ventricles in the brain. So I want to talk about some of the other brain areas that are impacted by schizophrenia because it provides an excellent review of the brain. So the frontal lobes are involved in a lot of different thoughts. They're involved in cognition, planning, language, judgment, and the difficulty of planning and organizing thoughts experienced by individuals with schizophrenia is related to frontal lobes being impacted. The temporal lobes involve memory disruptions, auditory hallucinations, and limbic system disruptions. So with the temporal lobes, it includes the limbic system, which includes the hippocampus, the amygdala, and the hypothalamus. And that hippocampus is responsible for the creation of new memories, and it's sometimes disrupted in patients with schizophrenia. The temporal lobes also contain Wernicke's area, and overactivity in this area, this speech-related area, may lead to auditory hallucinations or the perception that maybe internally created thoughts are actually coming from the outside. So there's something going on with potentially Wernicke's area and auditory hallucinations. And the basal ganglia, it's a group of structures involved with like goal-orientated voluntary movement and sensory integration and motion, motivation, has a lot of different functions. And disruptions in this area seem to be linked to hallucinations, paranoia. There's also, this is a motor movement, voluntary motor movement area. And excessive blocking of dopamine in attempt to control schizophrenic symptoms can sometimes lead to motor problems as a side effect of antipsychotic medications. So schizophrenia is primarily a brain disease, and so the treatment typically begins with medications. So, but there would also potentially be therapy for drug compliance, treating comorbid conditions. There could be other medical or psychological problems on top of the schizophrenic diagnosis, and also, education, family support. The two kind of broad categories for schizophrenia medications, these are all antipsychotics. There were the kind of original neuroleptics, the conventional antipsychotics. These were the first medications that came out. They were definitely dopamine blockers. They worked really well for positive symptoms, but they had some pretty serious side effects as well. And the most serious side effect is tardive dyskinesia, which is kind of a neurotoxic side effect of these medications, that excessive targeting of the dopamine is interfering with receptors that move the muscles in the face and the tongue, resulting in kind of involuntary movements of the mouth or the tongue that's kind of in constant motion. And the newer drugs, the atypical antipsychotics, are a little bit better at treating both positive and negative symptoms, and they have fewer side effects. Okay, let's take a quick break for a check for understanding. I'm going to give you a couple examples to test your knowledge of what we've been talking about and also thinking back to Unit 2. Okay, so the two neurotransmitters that are linked to the symptoms of schizophrenia are dopamine and glutamate. So dopamine has a lot of functions. It's definitely known as for its role in the reward pathway. It's also involved in learning, attention, and movement. And um, glutamate is your major excitatory neurotransmitter. It's related to a broad range of things, cognitive processing, sensory and motor functioning. And then in example 2, I asked you to come up with the three structures in the limbic system and their functions. So you can start with the hippocampus, which is memory formation. So sometimes the teachers use a mnemonic. A hippocampus is like a college campus where you learn a lot of things and you make a lot of memories. The amygdala is an important structure for emotions, especially fear and aggression. And the hypothalamus is a wide range of motivations and drives. So hunger, thirst, maintaining a stable internal body temperature. Okay, taking a look at treatment of mental illness. And we're going to, again, look at treatment through the lens of those 7 modern perspectives. So starting with the behavioral one, we did spend some time yesterday talking about systematic desensitization and counter conditioning with Mary Cover Jones. So you want to make sure you pay attention to the behavioral treatment methods because these do work in concert with the learning unit. So aversive conditioning, we did not talk about yesterday, is a way to remove a negative behavior by making an association between the behavior you want to remove and a negative experience, right? A stimuli you want to avoid. So sometimes this could be treating nail biting by painting kind of a sour tasting substance on the nails so that when the person bites the nails, they experience a negative reaction and maybe stop that behavior. Virtual reality exposure therapy is, a great way to help people work through a systematic desensitization hierarchy in a virtual safe place. Modeling therapy is based on the social cognitive theory of Albert Bandura. So this would involve helping individuals learn to cope with their mental illness or their stressors by observing and mimicking, sorry, I should say watching and mimicking a person who is successful. And finally, we have biofeedback theory, which is also something that comes up in the learning unit. This is a behavioral treatment for anxiety, where a person uses a monitoring device, like to monitor their physiological activity, and it allows them to gain greater and greater control over their autonomic nervous system. And they have greater control about breathing and heart rate, thus as a way to reduce their stress response. Okay, from the cognitive perspective, this therapy would be based on the fact that if mental illnesses are caused by dysfunctional, irrational thoughts, then the way to help the individual is to replace those thoughts with ones that are adaptive and realistic. So the 2 main theorists for cognitive treatment are Albert Ellis and Aaron Beck. And Aaron Beck is associated with using cognitive therapy in particular for treating depression and using cognitive restructuring to alter those illogical self-defeating thoughts and replace them with beliefs that are realistic, genuine, and adaptive. And a very similar method proposed by Albert Ellis is also about identification and replacement of irrational thoughts is rational emotive behavioral therapy, or REBT. I just want to mention briefly this idea of cognitive behavioral therapy. It's a very popular combination. It's very successful in treating a wide range of mental illnesses, and it involves incorporating both cognitive treatment methods, cognitive restructuring potentially, and behavioral methods. Could be exposure therapy, it could be journaling, it could be, keeping track of behaviors. Wow, did not expect that. I am so sorry. Okay, so psychodynamic. This is a modern adaptation of therapy developed by Sigmund Freud. So Sigmund Freud's theory was psychoanalytic, and this is kind of the modern version of it. There's still some discussion of unconscious drives and motivations and childhood experiences, but this modern therapy focuses more on current social relationships, developing greater self-understanding. It would also involve less intensive amount of visits, right? So they would probably only meet with a therapist once a week for a much shorter duration than traditional psychoanalysis. Okay, treatment orientation from the humanistic perspective, with your key theorist being Carl Rogers. There's also another humanistic theorist in the personality theory, you might remember, Abraham Maslow, but Maslow is less associated with therapy. Carl Rogers created a method called client-centered or person-centered, and he felt that therapy should be a genuine encounter between equals and not a cure from an expert. So he didn't even like to call people patients. So he went with client or sometimes person-centered therapy. And he felt that people would be able to improve if they had the right conditions, right? So a relationship of acceptance and support, that's your unconditional positive regard. And he emphasized a therapeutic environment that utilized active listening. It was non-directive. So the therapist is generally neutral and does not direct the actions or the decisions of the client. Okay. Biological orientation. This comes down to treating mental illness with medication or with other biomedical methods. So this can be, overwhelming when you're studying this in your textbook or your class, but you're basically looking at 4 broad medication categories. And we've already talked about antipsychotics, the conventional and the atypical. These are medications designed to treat conditions like schizophrenia, and they often work by blocking excessive dopamine. So they are dopamine antagonist drugs. The other 3 categories, antidepressant, anti-anxiety, and mood stabilizers, are also really important, and we'll go over some specific examples of each of those. With antidepressants, these can be used for more than just depression and bipolar. These are often prescribed to help individuals with anxiety, obsessive compulsive disorders, trauma and stressor like PTSD, or a variety of other conditions. These drugs are agonists. These are going to increase serotonin and norepinephrine. And there's a kind of 4 basic categories of antidepressants, and the most frequently prescribed are probably the SSRIs. But the MAOIs are agonist drugs that work by blocking down an enzyme that's involved in the breakdown of serotonin and norepinephrine. Thus, it's going to increase the levels of those neurotransmitters in the synapse. So these are all agonist drugs. Anti-anxiety medications are used for the treatment of a wide range of disorders. So anxiety, obsessive compulsive, trauma and stressor, or even insomnia. But it's important to note that SSRIs, depression medications, are also used to treat anxiety disorders because they have fewer side effects. Anti-anxiety medications, there's a variety of types, but the most commonly used is the benzodiazepines. And these work by increasing the transmission of the inhibitory neurotransmitter GABA. So they are an agonist. They're going to increase the activity of the inhibitory neurotransmitter GABA. And the final category is the mood stabilizer medications. And these are used for mania, hypomania, and aspects of bipolar. They typically work by reducing transmission of norepinephrine. So they're going to be norepinephrine antagonists. The most common one is lithium, and it's used to stabilize those extremes of emotion present in mania. But lithium does have side effects, and it needs to be monitored carefully because it can develop in toxic levels. Anticonvulsants is a newer way to treat the mania symptoms, and it's been approved for bipolar and mania, and it's been shown to be these medications, which are designed for convulsions, to be just as effective as lithium for some individuals, and in some cases, these have fewer side effects. Okay, so that brings us to the end of Unit 8, and hopefully you got some good review there from biopsych as well. Now I'm going to give you, as promised, a little bit more challenging AP exam practice. So I'm going to ask you to complete the following FRQ. It's going to be presented on 2 slides. I couldn't fit it on one. And we're going to go over the answers at the start of the review session on Monday. So this one is, as promised, a little bit more complex than the one that you received in the last couple days. So I'll give you a second to read that and look at part A and part B. So if you're looking at part A, it's asking you to indicate which neurotransmitters are most likely being measured. That's not present in the prompt, so you're just going to have to interpret that. And don't forget to define and then the apply, why is it being measured? Then you're going to describe the relationship between neurotransmitter levels and the number of positive symptoms displayed. And you're going to do that by looking at the graph on the next page. And then for part B, you're going to identify the independent variable or variables in the study, the dependent variable or variables in the study, and explain why this study was not a true experiment. So with that last part of part B, when you get to SODAS, you don't need to define true experiment. You just want to explain it and maybe define the term that's associated with why it's not a true experiment. Again, here's your graph. Okay, just want to make sure everybody got this information. This is a survey from the College Board. If you need to contact them about getting access to the internet or device in order to be able to take the exam. I want to make sure we reach all the students and give them a more effective solution if you have to take an at-home exam. Okay, thanks for watching. Hope to see you again next week. Have a wonderful weekend. Be safe. Take care of yourselves, your friends, and your family. And myself and Dr. Swope will be back next week to start with review of Unit 1. Take care, everyone.